Hi, we're here with Spectrum Health and Dr. Brian Lane, Chief of Urology at Spectrum Health Medical Group, and we're going to talk about beards for the boys and men's health. So thanks for being here.
Glad to be here.
Yeah, so we're just going to jump right in.
Sure.
Tell me, why did you choose to specialize in urology?
I think every guy wants to be a urologist, right? Isn't that how it starts? I mean, you wake up, you're born, you're a 5-year-old, and you're thinking, I want to be a urologist. So it's either
That was my dream, but
right.
I couldn't make it through med school. So.
Yeah. So it's professional athlete, astronaut, or urologist. Actually, what really happened for me was when I was in medical school and I saw all the different specialties, I really liked urology. For me, it's really broad. There's so much that kind of is involved in kind of that whole men's health space, and whether it's kind of normal or things that are starting to be abnormal in the health, or things that are clearly something's wrong, like cancer and things like that. It covers a lot of ground, and not everybody wants to be a urologist. So
Right.
to be honest, everyone thinks cardiology or heart doctors, that's really important. But there's something to me about being kind of off the beaten trail that was of interest.
Good. All right. Well, based on recent research and technologies, what do you think the future holds for urology? I know we do some robotic stuff now and things like that. But
Urology, interestingly enough, has had a history of innovation and technology, and the people who go into urology tend to be the people who are interested in the future, who are interested in what's the next thing that's up. And so, if we talk about surgical techniques, it was 50 years ago, the standard operation for BPH, or benign prostatic hypertrophy, was the rotor-rooter surgery, the TURP. And since then, we've had laser surgery, we've got outpatient procedures, we've got medicines, we have so many different things, and that's all really within this space of the last 5 decades.
Mm-hmm.
More recently, we've got the latest surgery on the block is what one of our partners does, which we can talk about too.
Yeah. So there's, it sounds like there's lots of options for when it comes to treatment with BPH.
Right. Yeah.
We actually have a live question. We have someone that is confused about prostate screening. Isn't it always better to screen than not to screen?
So that's a great question, and the simple answer to that is it depends, or it's really controversial right now. To what most medical societies and medical experts have advised is that you have a informed decision-making session about getting screened. And the reason why is because there's ups and there's downs. So there's risks and there's benefits to getting screened. When I talk to guys, I'm very candid that the benefits are to reduce the risk of prostate cancer death, but the risk, so there's the benefit. The risk is that we may find out that you have cancer. Then you got to come to terms with that. We may choose to treat your cancer, and if we treat your cancer, you may have some complications related to that. Even when we're going about finding out if you have cancer, having a biopsy, you could have complications from that. So there are risks and there are benefits. To me, once you've heard that, if you're motivated to get screened, I would get screened. I've been screened. I know, a lot of folks around the country still are very big supporters.
I've been screened.
Wondering what the hubbub is. But again, you need to have that candid discussion. But with that, I'm a supporter of screening.
Okay. Well, what can we expect to see from Spectrum Health in the future when it comes to men's health initiatives?
So a couple things. So one would be, further clarity and algorithms about screening, so that we can really get good information out there, so guys with good questions can understand, what should I do about this? The other things that are pretty controversial and important, one is on men's sexual health and sexual function, whether it's low testosterone, that there's a lot of opinions about and a lot of testing that's going on. Some men really have low testosterone and will benefit from treatment. Other men maybe don't need treatment, but there's some other things in their life that they can work on, healthy lifestyle type choices, which sometimes we don't like talking about, whether it's our eating habits or our exercise habits, what we're letting come into our body. And so those are all kind of real active and important men's health issues that need to come to the fore. And so we talked about screening, we talked about men's health. I'd say the last, which we sort of talked on, is the urinary health. and kind of how the bladders work and how the prostate's working. And so all of these areas continue to be areas of active investigation, new technology, new treatments, and things that we're really interested in.
Well, what are some of those new treatments or newest treatments that Spectrum is involved in?
So we talked a little bit about BPH already. So Dr. John Humphrey, he did a Periscope with us as well. And he's going to, I think it's on for next week. And so he'll talk more about HOLEP. HOLEP is a laser enucleation of the prostate. That's something that's really only done by experts who have experience and expertise in that treatment. The way I think of it is if you've got an apple and your prostate's a big apple, and instead of just taking the core out, that's that rotor-rooter surgery, it's like taking all the fleshy part out and just leaving the skin around. So this is kind of really a more extensive way to open up things so that the urine gets out. So guys with really big problem, that's a great fix for it, and it's something that we're offering now, again, when we're talking about what's new. That certainly is one of them.
Okay. Well, we hear a lot about prostate and testicular cancer, but what is benign prostatic disease?
So the difference, and so we talked some about prostate cancer screening, and then now we're talking about the symptoms. So it's not normal for a guy to go to the restroom and take a minute or 2 minutes to empty his bladder. That is, that's taking a long time. If you've got a slow stream, that's generally one of the main symptoms for BPH, or benign prostatic hypertrophy. Basically, this gland is growing and it's obstructing the flow of urine. And so that's what it is. It's when a guy has that, it doesn't mean he has cancer. He may, but more likely he's just got this condition, BPH. And so there are medications that you can take on a daily basis, and that'll help with the symptoms. If things get really bad, again, we've got procedures that can provide an even greater fix, and that's kind of what we're talking about.
Well, you mentioned medicines. So I see in the health food stores, they've got supplements and things like that. Do those work for guys, or is that part of the treatment that a guy could?
So what I talk about all the time with my patients is, what does work mean? So what are we hoping for? So if your hope is that your symptoms get better, so your urination is better, I think those things likely work. And there's some studies that suggest that. And so I encourage guys, I think they're fine to use. My concerns about them are, again, go back to what does work mean? So if they're claiming to prevent prostate cancer, there's no evidence for that. And if that's why a guy's taking a prostate supplement, there's no support to that.
Right.
You should get screened if you're worried about prostate cancer. But supplements are fine. If they're not doing the job, then medicines can likely be more effective. But I got guys who take all kinds of different things.
Sure. Okay.
We have another question from the audience. They say that studies show that there's an increase in depression in men. Are you seeing that in your patients?
I think that's true. I think it's true in general, but certainly in our clinic and our patients. We see a lot of guys who are struggling, and I think it's related to some of the things we just talked about. I mean, sure, everybody wants to be a urologist, but if a guy's coming to the clinic and he's either struggling in the area of sexual function or in the area of urination, these are things that are really core kind of guy things. And so it's not a surprise that guys who are coming in struggling with these things are more likely to have depression or other concerns as well. I think the low testosterone, again, kind of factors into it. So a guy whose energy level is low, is just kind of feeling down, or sex drive is down, that's something that happens with low testosterone. And kind of as we talked, when a guy has that experience or symptom, being depressed, is it because of the testosterone, or is it because of some other things? What do they need? Do they need more testosterone, or maybe they need to work on some things in their life, or maybe they need an antidepressant? So yeah, we're seeing it, and I think there's answers out there to help guys. Good.
When should men start to get screened for prostate cancer, and what should they be on the lookout for?
So usually what most, again, contentious, what most societies recommend is age 50, unless you have significant risk factors. And the two big risk factors are positive family history, so a relative or more than one relative with prostate cancer, or African Americans. Those individuals can consider screening earlier, even into their 40s. I think an initial PSA is a really helpful thing to have because it sets up the stage for how much screening you might need later in your life.
Is there any controversy about PSA?
Oh yeah, I mean there's
I mean,
plenty.
What's the main?
The main
there.
issue is that not every prostate cancer needs to be detected, or not every prostate cancer needs treatment. And so one approach is, if we're going to be over detecting or over treating prostate cancer, why don't we fight against that? Why don't we detect less? Because if we find fewer cancers, we'll find fewer that we shouldn't have been looking for. The people who are in support of PSA will say, if we just right across the board choose not to use this test, which helps us find prostate cancers, we're going to find prostate cancers later. And so we will have missed finding some of the ones we really needed to find. The ones that earlier treatment would have helped the men, and now we're only finding them later. So to me, the discussion really shouldn't be should we screen, it's should we be more discriminating in who we treat. So if you find one that's a low risk cancer that doesn't need treatment, trying to convince guys you don't need treatment. And that's not easy to do, but it's something we actively do in the clinic all the time, is just because you have cancer, that might be cancer with a little c, not cancer with a big C.
Oh,
So.
okay.
We have another question. We have someone who years ago had a high PSA. The biopsy was clear and went on medication, now is having symptoms and high fever. Wondering if you can talk about what prostatitis is, symptoms, and any indication of that.
Sure. So that's a great lead in again. PSA, when it's high, can mean a guy's got prostate cancer, or BPH, which we talked about, or inflammation or infection in his prostate, prostatitis. And so some guys have that. Guys who have an enlarged prostate are more at risk to develop prostatitis in their life, but really any guy can get it. And it sounds like this is someone struggling with it. Again, if you think you've got a urine infection, if you've got fever, if you've got difficulty urinating, prostatitis continues to be a problem. Antibiotics are what you need, and that should go away. And again, from a PSA perspective, that's not cancer. And if your PSA is high because of prostatitis, I think it's good you had the PSA because it helped you figure out you had an infection. But we don't want to walk down the road of thinking about cancer. But for this individual, yeah, he's likely got a big prostate, and we know that those guys are more likely to have prostatitis in the years to come.
So, if I understand correctly, a high PSA doesn't necessarily translate to cancer.
Right.
It could be
Those
a
other
variety
causes.
of things.
Yep.
Okay. Do you have anything else you'd like to add to before we end our Periscope?
Well, I think it's. I appreciate the questions that we talked about and of our viewers. And again, there's so many different men's health issues. And I think the point of November and our Beards for the Boys initiative is really to bring these things to the fore, because a lot of guys don't want to talk about it. Not everyone really wants to be a urologist, I got it. And not everyone really wants to talk about their sexual function or the difficulties that they're having or with their urination. But hey, it's important. And that's what we're here to do, is to really to be a support to guys who are struggling, and to be a resource about what are the opportunities to connect and get access to care.
Good.
So.
Well, here's the
Oh yeah.
But we've got an event coming up on December 1. It's our Beards for the Boys Beard Off. And you can go to beardsfortheboys.org and register there for the event. You can find out all kinds of information. We've got a great infographic on the beardsfortheboys.org website. So please go there, check it out. There's opportunities to contribute. The money will go towards our foundation and men's health. And you can text to give and all kinds of opportunities. So beardsfortheboys.org, #BFTB. And yeah,
TV.
beard heads.
You got it.